कि आप जो नए शिफ्ट के साथ अपने जीवन को जिएंगे, इसमें कुछ अच्छा बेहतर लाइफ को जी सकेंगे और इस समाज को, अपने पेशेंट्स को, अपनी फैमिली को ज़्यादा कुछ दे पाएंगे। तो क्रक्स में अगर जो हम अब तक सुनते आए, मैं अपनी बहनों से निवेदन करूंगी कि आएँ और हमारे गेस्ट का वेलकम बैजेस और फ्लावर्स से करें। आपके लिए 2 लाइन कहना चाहूँगी। आप जीवन रक्षक हैं, स्वास्थ्य पथ प्रदर्शक हैं, वैद्यनाथ शिव की संतान हैं, आप दुआ और दवा के सेवक हैं, आप दुआ और दवा के सेवक हैं। डॉक्टर सतीश गुप्ता का परिचय मैं संक्षिप्त में देना चाहूँगी, जब तक हमारी बहनें हमारे गेस्ट का अभिनंदन करें। हम तालियों से आपका स्वागत करते हैं, अभिनंदन करते हैं। Dr. Satish Gupta did his MBBS from Maulana Azad Medical University, New Delhi, followed by MD. He was awarded FCCP Cardiologist Fellowship, then FIAE Fellowship, FIMSA Fellowship. He has a long list of achievements and contribution. His biodata is very long, but I'm just cutting it short with his permission. He got 3 Lifetime Achievement Awards for outstanding contribution in cardiology in Word by Shrimati Sheila Dikshit, Honorable CM in 2010, then by Shrimati Pratibha Patil, President of India in 2008, then by Dr. APJ Abdul Kalam, President of India in 2006. He also got 2000 Millennium Award of Honor from ABI USA. He was also honored as Outstanding Scientist of 20th Century Award for Evolving Soul, Mind, Body Medicine for Health Management by IBC Cambridge, England. And as Outstanding Scientist of 21st Century 2003 by ABI USA. There's a long list, but in short, and most important, he has been practicing Rajyoga meditation since 1986. और 1995 से आप ग्लोबल हॉस्पिटल एंड रिसर्च सेंटर में एज डायरेक्टर अपनी सेवाएं दे रहे हैं। उन्होंने 2006, 7, 8, 9 और 10 में वर्ल्ड कांग्रेस ऑन क्लिनिकल एंड प्रिवेंटिव कार्डियोलॉजी भी ऑर्गेनाइज किया। और आपका सबसे इम्पॉर्टेंट जो प्रोजेक्ट है, कोरोनरी आर्टरी डिजीज रिग्रेशन थ्रू हेल्दी एंड हैप्पी हार्ट लाइफस्टाइल मॉड्यूल, जिसमें आपने मेडिसिन, मेडिटेशन, डाइट, एक्सरसाइज के कॉम्बो पैक से लाइफस्टाइल चेंजेस करके आर्टरीज के ब्लॉकेजेस को दूर किया। उसमें मैं अपने फादर का एग्जाम्पल कोट करना चाहूँगी। उनको भी ब्लॉकेजेस थे जिसमें उन्हें कहा गया था कि आप अगले वीक के अंदर ही आप अपना ऑपरेशन कराएं, बाईपास सर्जरी कराएं, और हमने एस्कॉर्ट में उनका अपॉइंटमेंट भी ले लिया था। बट आई जस्ट सजेस्टेड हिम कि आप एक बार यहाँ आएँ और ये फॉलो करें। और उसके बाद में बिना बाईपास सर्जरी के उन्होंने बहुत लंबी ज़िंदगी जी। तो ये एक प्रैक्टिकल एग्जाम्पल मेरे फादर की ही लाइफ का, ऐसे बहुत सारे लाइफ के एग्जाम्पल्स हैं। आपके लिए ज़्यादा ना कहते हुए मैं सिर्फ 2 लाइन कहना चाहूँगी। सुप्रीम सर्जन के रूहानी हॉस्पिटल में, सुप्रीम सर्जन के रूहानी हॉस्पिटल में आप डबल डॉक्टर, डबल इलाज करते हो, दवा से तन का, दुआ से मन का, और रूहानी मुस्कान से आत्माओं का दर्द हर लेते हो, आत्माओं का दर्द हर लेते हो। डॉक्टर सतीश गुप्ता।
ओम शांति। अब सबसे पहले तो मैं आप सबका बहुत बहुत स्वागत करता हूँ। आप सभी थोड़ा आगे आ जाएं तो बहुत अच्छा लगेगा। सभी जो पीछे बैठे ना, लेट्स हैव अबाउट 45 मिनट्स ऑफ फोकस्ड मेडिटेशन, फोकस्ड सेशन, क्योंकि आपके हार्ट की बात है और आप में से एक कम से कम 10,000 हार्ट के पेशेंट ठीक कर सकते हैं ना। अगर आप खाली हार्ट के नहीं, पिछले 25 साल में हमने पाया है खाली हार्ट के नहीं, मन और तन की सभी बीमारियाँ ठीक हो जाती हैं। तो मैं आपसे आज वही शेयर करने जा रहा हूँ। ओम शांति। चलिए लेट्स स्टार्ट विद 1 मिनट ऑफ साइलेंस। सभी सामने आगे आ जाए, मेरे पास आ जाए। मेरे दिल की बात दिल के नज़दीक होनी चाहिए ना। सभी पास आ जाओ। सभी पीछे बैठे पास आ जाओ। पास में आने से ही ब्लॉकेज खुल जाएंगे, अगर होंगे कहीं तो आपके पास, है ना। ओम शांति। सबसे पहले तो आपने सीखा मेडिटेशन क्या है। यहाँ पर सभी ने सीखा क्या है मेडिटेशन। यस, योग या मेडिटेशन है। योग मीन्स कनेक्शन, इससे भी कुछ और है। योग मीन्स कनेक्शन, कनेक्शन, राइट। और मेडिटेशन मीन्स हीलिंग। मेडरी वर्ड से है ना, टू हील, एंड मेडिटेशन ऑल्सो मीन्स to focus, to concentrate, right? So connection for healing, connection to concentrate, right? Okay. So connection to what? Connection with the truth. Connection with the truth. What is truth? सत्य की परिभाषा क्या है? हाँ जी, सत्य, truth is eternal. First thing is truth is eternal, beyond birth and death. Second is truth is unchangeable. Truth अपरिवर्तनशील है, सत्य कभी बदलता नहीं है, सत्य कभी मरता नहीं, शाश्वत है सदा। तो आपका सत्य क्या है? What is your truth? Body is changing, roles are changing. Roles means I am a doctor, I am a husband, I am a wife, I am so and so, I am a businessman. This is daily changing, right? But what is not changing? The soul. Soul never dies. Dr. Shubda was telling us just a few minutes back that at 5 months of pregnancy, the soul enters the body. The soul enters the fetus. And then the mothers can feel the movement of the baby, right? And when the soul leaves the body, then nothing functions, right? So soul is eternal, body is mortal. So we have to connect. Continuously we should remain connected that I am a being, I am a soul. That is meditation. Once you are connected with your own truth, then you are automatically connected with that supreme truth, right? The supreme being, the God, powerhouse of 7 spiritual energies. So whenever you are told to have a minute of silence, that means put a full stop to the past, be focused in your truth, get connected to the truth, and then you can get connected to the supreme truth, right? That is meditation. And that should be practiced always. All our problems, all our diseases are because of we are connected with our unreal, untruth, falsehood. I am a doctor, I am so and so, I am head of the department, right? That is the culprit. I am the husband, I am the wife. Then the whole problem comes in. You are not born as doctors. We were not born as doctors. We were not born as husbands or wives or parents, right? We are playing roles. Roles are not permanent, right? That creates problem. Dis-ease, loss of ease. So let's start with our topic. Today's topic is healing the heart. I'll just share with you, and we call it 3-dimensional healthcare module for healthy heart, happy mind, and healthy body. It's not only for healthy heart, but it's also for happy mind and also for healthy body. Each and every cell of the body changes. Each and every thought, emotion of the human being changes with this program, right? 3-dimensional means addressing all the 3 dimensions of human being, the soul, the mind, and the body. So, this is my hospital where I joined in 95, April 95, And this is another hospital, we call it trauma center. And now, just to share with you before I start on this research project, at present this disease was in 1960s, it was only 1% of population was having heart disease, but now it's about 14% of population. In 2015, about 62 million cases in India were documented as coronary artery disease patients, right? And out of which 37 million were below 50 years of age. And in that year, about 29 lakh people died because of CAD and stroke. And out of which, about तो आप देख पा रहे हैं, that means about, and for every heart patient there are 2 hidden heart patients, right? So you can imagine that now out of 140 crore people in the country, at least we have 20 lakh people suffering from, 20 crore people suffering from heart disease, about 14% of the population. And every year almost 30 lakh people die because of this number 1 killer in the world, out of which about 16 lakh are below the age of 50 years. So it's a disease not of old people, but it's a disease of younger people, less than 50 years. Now I'll just share you with some cases. You can see on the screen there. This is a patient who had a triple vessel disease. He is an industrialist. He had hypertension, diabetes, smoking. He's obese person, sedentary lifestyle. And he also, he had his angioplasty done in 2007. Again, after 3 years, there was a blockage in that. There was instant restenosis. And then he had another block coming up. So he had angioplasty stents, 2 stents given in 2010. 2014, again, he started having symptoms. Then bypass was done in 2014, right? And then, if you see here, again, in just 2 months after bypass, he developed symptoms. And then he went to Houston, USA, and all the grafts were found blocked. And there in Houston, he was given balloon angioplasty to all the stents, all the grafts. And after just 4 months of getting balloon angioplasty done, again, he could not walk 50 meters. Then he came to us. So this patient since then is fine. And now it's 9 years. He is walking 5 kilometers a day without any symptoms. And you can see this. You can see that his grafts, all the grafts are blocked. I can't come and show you on the screen there, but you can see that all the grafts have got blocked. All the stents have got blocked again. So basically, angioplasty or bypass is not the ultimate treatment. It is only a palliation. It does not address the root cause. I'll show you another patient who is not hypertensive, who is not diabetic, who is not a smoker, who is a lean and thin person. He is 5 feet and 8 inches in height, and weight is only 62 kg when he came to us. But so the hypertension, diabetes, or no hypertension, diabetes, smoking or not smoking, still you can have the same problem. 2013 he had angioplasty done. 2014 the stent got blocked, so 2 more stents were put, and 2015 he had to undergo bypass surgery. 3 years, every year he had to undergo angioplasty or bypass, and still after 2 months of bypass he had again problems. So another type of patients in India we get is diffuse disease. Out of 100 heart patients, CAD patient, documented patients, angiography documented patients, 54% patients have diffuse disease, which is not operable. You cannot, these people cannot be given angioplasty because the stents, the grafts, the blockages are very long. Almost the whole artery is blocked, and they are also not amenable to bypass surgery. See this? You can see this? Multiple blocks and not amenable for surgery. Now this is another patient. She is the director of an NGO in Delhi. Till now she had 13 stents and 1 bypass. And when she came to us, she could not walk 100 meters. She tall lady and 5 feet and 9 inches, and not obese, not hypertensive, not diabetic, but a lot of stress, and she has the problem. Right? And since then she is okay. For last 5 years she is okay. And similarly, you can see another patient. This is the angiography of this patient, and then see another one. He's got 7 stents already in the body, and still he was not able to walk, and now he's okay. Right? And so whatever we are doing, angioplasty or bypass surgery, or we are using statins for every patient. This does essentially palliative. It does not address the root cause. Root cause is genes. Root cause is mental stress. Root cause is diet, exercise. Wrong diet, wrong exercise, wrong sleep, and we take a lot of tobacco these days. So all these treatments, whatever the modern healthcare is giving us, it is only one-dimensional. It addresses only the body. While everyone knows today that CAD, coronary artery disease, is a psychosomatic disease. It's a lifestyle disease. Only by addressing the body, we cannot treat the disease. And you can see another patient. He is from USA. See this multiple blocks and diffuse disease, not operable. He came to us, and now is much better. See, in US, we have about 20 lakh heart attacks occurring every year. In India, we have 70 to 80 lakhs heart attack every year. Out of which, for 4 lakhs, we do angioplasty, and for about 1.5 lakhs, we do bypass surgery. Can we do 70 to 80 lakh bypass surgeries or angioplasties in our country? And for this, they do about 13 lakh angioplasties every year and 4.5 lakhs bypass surgeries every year. That year, in 2006, they spent 104 billions in these 2 procedures. Nowadays, they are spending about 150 billion rupees, $15 billion for these 2 procedures in their country. Can we afford 150 billion rupees to be spent on these 2 interventions? Is it possible? Our total health budget is not this much, right? So we cannot do it. Numbers are enormous. So I was talking about genes. Genes are very, very important in causing coronary artery disease or hypertension or diabetes or insulin resistance, metabolic syndrome, or for that matter GERD, for that matter any disease of mind and body. Genes play a great role. And in 2009, Nobel Prize was given for healthy aging to Miss Elizabeth Blackburn, Carol Grider, and Jack W. Jostek. And there they've seen that if you do meditation regularly, you change your diet. Main thing is balanced diet, not naturopathy or anything else. It has to be balanced diet, which should contain carbohydrate in proper amount, proteins, fats, vitamins, minerals, and water in proper amount. And lifestyle change means follow your clock, biological clock. There's a circadian rhythm. There's a time to go to bed, time to get up from the bed, time for meditation, time for planning, time for exercise, time for breakfast, time for lunch, time for dinner, and time for working. The best times with the best efficiency. That is the best time. So then, if you follow this meditation, diet, and exercise just for 3 months, you can change gene expression in hundreds of genes within a small period of 3 months. And they have seen that genes associated with CAD, cancer, obesity, hypertension, and inflammatory bowel disease, and also rheumatoid arthritis, SLE can be turned off or down regulated, and protective genes can be turned on. Actually, we have planned, I'll just share with you little later, and I'll just be showing you practical model of healing the heart. This research which we started, this is the research we started in 95, April 95. This CAD research program was, I had a vision. You must have been told about Brahm Muhurat meditation. You are doing Amrit Vela meditation daily? 4 AM meditation here? So I got this knowledge when I was in AIIMS, Delhi, on Institute of Medical Sciences in Delhi. That time, you know, we used to stay in Gyan Nagar, and we were very busy. We used to go at the hospital at 7 AM and come back at 12 or 1 AM or 2 AM in the morning, have 4 hours sleep and go back again at 7 AM in the hospital. Because we have to get everything ready by the time consultant comes. I had started my MD there in 1986. So then one day we were going to the cinema, and the film was Nagina. You know Nagina? Rishi Kapoor and Sri Devi. That was an Upahar cinema. That was across the AIIMS. And on the way, my wife was sitting behind me, and my son was, that time he was less than 2 years old. He was just in front. And then my wife saw a Brahma Kumari center there. It was written Gateway to Heaven. She told me that, where are you taking me? Gateway to hell. I don't want to go there. I want to go there, go inside. And then we entered that center, Gateway to Heaven, in South Extension. And since that day, August 25, 1986, we are just inside there, inside that place only. We have not come out of heaven. So in Feb 95, I had a vision in morning meditation, 4 to 5 AM. Actually, that day when we entered the center, the teachers gave us, the Brahma Kumari teachers, they showed us the exhibition. And it appealed to me, yes, this is the truth. And then only thing we asked them, can we talk to God? Yes, they said, yes, you can talk to God. And then we started practicing meditation since that day, 4 AM meditation. We never missed our 4 AM meditation. Once I understood who am I and who is mine, since then I never missed my meditation, morning meditation. And during one of the morning meditations on 26th and 27th Feb 1995, I had visions on how to open the blockages, or how to regress the disease, how to address, for that matter, any disease of mind and body. And then I started delivering talks on stress and heart disease, because I was working in one of the premium heart hospitals in Delhi, the only heart hospital you can say. I'm not naming the heart hospital. You can understand yourself. In 95, which was the main premier hospital in Delhi. And I was working there. And because we used to do angioplasties, we used to put the stents. And within, sometimes within 3 months, within 6 months, people used to come back with another acute coronary event. And then we used to ask them, you have developed a new problem. Angiography reveals that the stent has got blocked and new blocks have come up. So you have to undergo bypass surgery or angioplasty. So then the patient used to tell me, Dr. Saab, we sold our house to get our angioplasty done, stenting done. And last 6 months, I'm not working at all because of my problem. And now you're telling me you have to undergo another angioplasty or bypass surgery. What should I sell now? That moved my mind, my heart, you can say. Not this heart, this heart. And then I started reading much more. And then we in those days, 95, Feb 95, March 95, we were reading a lot of articles in circulation, American Heart Journal, and the European Society of Cardiology Journal, many studies were coming which were telling us that type A behavior, people who have type A behavior, do you know what is type A behavior? Type A behavior means feeling pressure of time, pressure of work, and pressure of perfection, pressure of competition, pressure of comparison, right? Aggression. So this is a pressure-based lifestyle. People who have pressure-based lifestyle, that is that in those people you get 3 times more chances of getting heart attacks. People with anxiety, they have 2 times more chances of getting heart attacks. People with anger, they have about 3.5 times more chances of getting a heart attack. People with depression have got 5 times more chances of developing heart attack. People who do not ventilate their minds, they have 3 times more chances of developing heart attacks. Similarly, people with cynical behavior, finding fault with others, people with hostile behavior, they have got much more chances of developing heart attack. So I planned one lecture for our IMA people, DMA, in Delhi we call DMA, Delhi Medical Association. And I started delivering talks. On 6th March 95, I was delivering a talk in one of the gatherings. And there one of the DRDO scientists listened to my talk. And then he talked to Dr. APJ Abdul Kalam. He was the Director General of DRDO at that time. And then Dr. Kalam called me on 9th of March. So I shared with him, and he said, Dr. Gupta, this is a wonderful idea. If meditation can regress, meditation can open the blockages, can reverse the heart disease, it will be a great boon. So you do this research, I am with you, my whole DRDO is with you. And then we planned a research with DRDO, and 3 tertiary cardiac centers, one in Delhi, one in Ahmedabad, and one in Mumbai. We collaborated with them and planned a research program, submitted to Ministry of Health, and then 9th March I met him, and 14th April I shifted to Mount Abu. 14th April I started from Delhi and shifted to Mount Abu. 15th I was here. Can you imagine? Just 1 year and how many days? 6 days. 1 month and 6 days. I packed up everything and shifted. Because I was coming here since 1986, and I found this place to be very peaceful, very loveful, very happy. And Delhi was a very busy place, very fast, people with very fast minds, a lot of pace in our lives. So I thought that this is the best place to come and start working. And then so this research we started in first program, started in Feb 98, officially we call. And in between, time is very less, but still I would like to share. So submitted, when I came here, after 1.5 years coming here, I started having chest pain. My age was only 37. In November 97, I started developing chest pain. And one day in the evening, I had very severe chest pain, just at the age of 37. And my ECG went haywire, but it's not very typical of heart attack. And I got my angiography done in Mumbai. It was normal, absolutely normal. Echo was done. They could not identify the disease. But I could not sleep. I think it's November 24, November 96, I had the problem. And I could not sleep. I could not lie down on the bed because I used to have a lot of chest pain, heaviness on the left side, and my left upper limb was almost numb, totally numb. I could not sleep the whole night. I used to have arrhythmias, ventricular tachycardia, lot of VPCs, and I could not sleep for the whole November, December, January, February. 3 months I could not sleep. I was not able to sleep at all. During the day, sometimes I was just sitting and just having a nap, but it was not a typical sleep, getting sleep for 1 hour or 2 hours, not like that, because I was having a lot of arrhythmias. So in Feb 97, I went to Delhi. I went to Udaipur. There was a eco conference because I am one of the founding members of Indian Academy of Echocardiography. So there, one of the friends from Mayo Clinic, US, he was there. He said he saw my face because I was not sleeping for last 3 months. And so he said, Dr. Gupta, what has happened to you? I said, I am having this problem. Let me see your heart. Because he was a hypertrophic cardiomyopathy expert. He saw my heart and actually he said, Dr. Gupta, you are suffering from hypertrophic obstructive cardiomyopathy. Your heart muscles have become almost 21, 22 millimeter thick. And your LVOT also has got blocked. There's a gradient of 96 millimeter of mercury. And on Valsalva, it was going almost up to 150 millimeter of mercury. That is why I was not able to sleep. Because gradient was so much and my heart was so heavy. And doctor, he said, come to US, we'll do a alcoholic septal ablation and we'll put a artificial pacemaker, AICD, and then, but there are high chances that during that problem also you may have problems. So then I came back from Udaipur and because we have a Dadi Gulzar, you know, she was a translated messenger of Shiv Baba. So we used to give Dadiji, we gave a message to Baba and Baba says, this disease has come not for operation, it has come to make Dr. Gupta authority of experience. Anubhav ki authority banane ke liye aayi. Because he had started a project on heart disease that without surgery, without angioplasty, blockages can be opened, but he has no experience of RAJYOGA meditation in the right way. So then I was given 1 month by God to do more meditation. I started meditation, more meditation, 8 to 10 hours of meditation. I took leave, but there was no effect on my heart, on my symptoms. Again, after 1 month, we gave a message to God and he said, Dr. Gupta is not doing meditation the right way. You are not doing message in the right way. Then I was explained the method of doing RAJYOGA meditation in the right way by God himself. And then I started doing it and third day I got sleep. Third day of doing the meditation the right way, I got sleep. So you have been hearing, you must have been hearing here visualization. Visualize this, visualize this. The soul cannot be seen. Supreme soul cannot be seen. Subtle regions cannot be seen. You cannot visualize them. Right? You can only revise what God says and you realize that. And then you will have experience. Right? जो मुरली कहते हैं ना, परमात्मा की मुरली, महावाक्य कहते हैं ना, ये जो आज की मुरली जैसे. Every thought, every sentence in this is from God, directly from God. You have to first listen to it properly, then revise it with that love that God is telling me this, and then सच्चे दिल से उसको महसूस करना है, एक एक बात को. जैसे माँ बाप की बात को महसूस करते हैं ना, उसको महसूस करके मुझे ऐसा बनना है, तब आपके जीवन में परिवर्तन, तब अनुभव होता है. राइट? अनुभव होता है आपकी. It is not only doing, I am a soul, supreme soul, son of supreme soul, किरणें आ रही हैं, ऐसा नहीं, इससे उससे परिवर्तन नहीं होगा. Your behavior should change. The purity should be in your behavior. Peace should be in your behavior. Purity, what is purity? I am being, you are also being. I am a shining star, you are also shining. I see you also as my wife, my son also as shining star. A peaceful star, as a loveful star, as a happy star. Right? What is peace? Peace is being in the present. Love means accepting people as they are. Accepting, nourishing people as they are. Not as per me, as per my condition. That is the cause of the heart disease. Peace is being in the present, not always in the past. We remain mostly in the past. Our subconscious mind is full of psychological, emotional hurts. So when I started doing this meditation the right way, then within 3 days, third day itself I got good sleep, supine. And then 3 months, I was absolutely fine. After 6 months, my echo was done by the same person again in September 1997, who had come in Delhi conference. And he said, Dr. Gupta, what has happened? What have you done? Your heart has become normal. My ejection fraction was 90%. Normal is 60%, right? My ejection fraction became 65%, which is normal. My heart muscle, which was 21 millimeter, became 13 millimeter. Posterior valve, which was 17 millimeter, became 10 millimeter. Gradient, which was 96 millimeter, became 12 millimeter. And doctor in 97, that fellow from Mayo had told me that, Dr. Gupta, if you do not get operated, you cannot stay, you will not survive 2 years. I am still alive. Right? In 23, I am alive. I am alive or not? Yes. What do you say? No, I couldn't get you. I'm not able to get you. Okay, I'll share you the personally, because time is not there. There is this. The people in the hall, they will say, no, time is over, time is over. क्या लिया? नहीं, माइक दे दो ना, कोई माइक दे दीजिए. पेशेंस रखा मना?
Oh, आपके धीरज, patience. How did you keep the patience?
The patience, because I got the message that this disease has come to make you अनुभव की authority of experience, right? But I was not doing meditation for 11 years. I was not doing meditation the right way. My technique was not correct, right? Suppose I am treating a patient, but my technique is not correct, then the patient doesn't get relief, right? अच्छा, मैं बताता हूँ. चलिए अभी हम आगे चलते हैं. चलो अभी आगे चलते हैं ना. So this paper, I wanted to just, God has said time and again, it's revise and realize. What Baba says in the Murli, you revise it, like mother has told me something, I keep on revising. My mother told me this, my mother told me this, my father told me this, son, you have to become like this, you have to become like this. Same way the Supreme Father tells me daily morning, son, you have to become like this, son, you have to become like this. Today you have to do this, you cannot be angry, you have to be sweet with everyone, right? So I revise it again and again, and then realize that, yes, what is sweetness? Sweetness only not in speech, in eyes. Sweetness in listening. Sweetness in behavior. Sweetness in walking. Sweetness in talking. Everything should be sweet, right? Sweet means what? Sweet means full of 7 energies. Deities are sweet in behavior, right? They are full of 7 energies. So I have to become like a deity, right? So I'm just giving you one example. So then when I practice this daily with people, then I become experience. I get experience I become authority of experience, right? And that will change my heart. Love. Love means I accept someone is abusing me, insulting me time and again, in the office, in the house. But I accept that person as it is. I say either you change or disappear. No. Whatever you are, I take care of you. I accept you and will take care of you. That is love. Why we call God ocean of love? Tu pyar ka sagar hai. Because he accepts us as we are. Isn't it? That is love. So that is realization. Realization leads to experience, right? And experience, when you experience any point in the Murli, or peace, love, or happiness, whatever it powers, then you become saturated with that, then your old behavior will change. My problems, my diseases are because of my old wrong behavior. Heart disease or lung disease or my GI problem, my liver problem, my bone problem, back problem or knee problem or migraine or thyroid or whatever. My eye problems. My number was 3.5 in the right eye and 3.25 in this eye. And 1.5 near distance and 1.25 in the cylindrical error of 3 in both the eyes. From 16 years of age, my number was increasing, and at the age of 59, my number, I got rid of specs. For last 6 years, I don't have specs. Right? Huh? So, this is the effect of revise and realize, right technique. That means your behavior should change, right? That is meditation. So we published this study, and this study was published in 2011, September, and 2013 we were informed by the ABI USA that your study is #1 in top 20 studies in the world. It's most documented, most sort of read, most cited by the doctors, researchers, and public. And this is the only study, Indian study in the world that which remained #1 for 2 years and 4 months till November 2015. And then it was documented by American Heart Association in their scientific statement on meditation and cardiovascular risk reduction in 2017 as a study which the RAJYOGA meditation, this we call it 3-dimensional healthcare, as a study which not only regresses heart disease, but it's also good in treatment, management of hypertension, diabetes, smoking, and other risk factors leading to heart disease, right? So basically this 25, now we have completed in this FAB 2023, 25 years of this program, and on this, in this year, on 10th of May, our Prime Minister, Shri Narendra Modi, was here, and we had the foundation stone laying ceremony by him of Global Institute of Health Sciences, a super specialty hospital, and just in front of that we'll have a Arogyam, Academy for Healthy and Happy World, Global Institute of Heart, Health and Lifestyle Sciences. So within 1.5 years or 2 years, we'll have this institute coming up, in which we'll be treating heart disease, people suffering from heart disease, and also from other lifestyle disorders like hypertension, diabetes. In last 25 years, we've been able to find out, we have seen that people with hypertension, diabetes, people with 50 units of insulin, they also have been able to get rid of insulin, anti-diabetics. The people with HbA1c of 13, 12, 13, 14, now they are all right without any medication. Right? At now HbA1c of less than 6. Hypertension which was not controlled, people with prostatic cancer, they are all right. They could regress their prostatic cancer. They could get rid of bronchial asthma. They could get rid of GERD, long-standing GERD, skin problems. They are okay now. Prostatic cancer, we had some studies. Now we are planning, because in this new center, we are going to have a metabolic lab, a neuropsychology, physiology lab, and also a molecular biology lab, so in which we will be able to document each and every aspect of meditation and stress. So in this new center which is coming up, right? So I think I just, I have finished with my time. So I just share with you, this is how the heart arteries are there, and you can see this angioplasty is, we must have heard a lot about it, and bypass and angioplasty is not the ultimate treatment. Jagdish bhai, Jagdish bhai ko mic de dijiye. Jagdish bhai mic de dijiye. He will share his experience. And this research program was started in, I told you, in 1998, February 98, in which cardiologist, physiologist, एक chair लेके बैठ जाए तो अच्छा रहेगा. Cardiologist, physiologist, and endocrinologist, clinicians, and psychologists, spiritualists. We all worked hand in hand we have been working for last 25 years. And this study, which I already told you, which has been published, another randomized control study, Abu Healthy Heart Trial, is under publication. Yes, and the patients who could not walk 50 meters, they are now walking. He will share you, he's one of the patients. We call them Dilwalas. We don't call them heart patients, right? The ejection fraction also improves, and the exercise tolerance he will share with you. And lipid profile also, those were not the days of statins that much, right? Though we were using statins, but it was not a must. We can reduce LDL, increase HDL and decrease also triglycerides significantly, right? And 93% patients could open their blockages. You can just have a look on the screen. And you can see this 90% block opening up, right? Can you see this? A diffuse disease, long block which is not amenable for angioplasty, opening up. 100% calcified, we had 50 100% calcified blockages, out of which 29 blockages opened up. You can see this? See this 100% block opening up, these multiple blocks opening up, 80 and 90% block opening up. Ejection fraction, it was 30% in the first angiogram. Second angiogram, it has become 45% after 1 year. Another angiogram, 80% block, ejection fraction 20%, ejection fraction becoming 50%. Another block, 100% block, calcified block, opening up. Control group, there is no opening. Because अभी जो मेरे पास patients आते हैं ना, reports आती हैं मेरे पास daily. उसमें just by looking at the angiogram, because we do psychological analysis for every patient, day 1, day 7, and then every 3 months we repeat. And then angiogram is repeated every 6 months, after 6 months of following the program. And the blockages open up, and we do the repeat psychological analysis. So we can find out, now I can say, actually this is experience now, I'm able to say it for last 18 years, that for every, looking at the angiogram, we can find out the thought patterns of a person. कि इसके मन में ये चलता है, इसकी अपने हस्बैंड से या वाइफ से ऐसी रिलेशनशिप है, ये घर में या ऑफिस में कैसे काम करते हैं, क्या इनका बिहेवियर है, उनकी एंजियोग्राफी देखने से पता लग जाता है, राइट? जैसे जोशी होते हैं ना, ऐसे उसकी एंजियोग्राम देख के पूरा बिहेवियर पता लग जाता है. ये दिस इज अ साइंटिफिक डाटाबेस, राइट? दैट्स व्हाई दिस स्टडी इज नंबर 1 in the world, right? Okay. Yeah, it has been published. Mount Abu open heart trial. Indoor patients also. अभी हम लोग every year, we till now we have done 176 groups, 10,480 patients we have done till now. Angiography documented patients who have come to us, and because now after COVID we are doing only 5 programs in a year, and rest 7 months or 8 months we do on a daily basis. Patient come, send the reports to us, and we do their online consultation, or they come to the hospital. We keep them in the hospital, and we give them consultation and advise them, because all the time the patients keep coming, and we advise them on a daily basis. So you can see this, for every block there is a thought pattern. If you just follow the diet and exercise, blockages will not open up, because you have to change thought patterns. If you can change the thought patterns with the Rajoga meditation, then the block will open up. It's not only about heart disease, it is about coronary carotids, vertebrals, renal artery, lower limbs, everywhere, anywhere. Even the bone disease, osteoarthritis of knee joint, intervertebral disc spaces, that is also because of, that is also as a vascular cause. Even if you can change that, the vascularity of that, the osteoarthritis also disappears. The cartilage will regenerate. I have treated so many patients with this, interval disc disease and the osteoarthritis. That also improves, right? But without deformity. If deformity comes in, then we cannot operate, right? We cannot treat. So this, see this, blocks have increased. Another angiogram. See this? This is a 100% calcified block, and the repeat angiogram, it has opened up. दिखाई दे रहा है आपको? So this EEG, the psychological stresses have changed. EEG we have done. You can see this EEG, normal is beta rhythm, alpha is peaceful rhythm with closed eyes, theta is loveful rhythm when you start accepting people as they are, and delta is deep sleep. It's a bliss, happy and blissful rhythm. Just in day 7, on day 7, alpha rhythm is increased so much, beta rhythm has gone down, theta rhythm has increased, and delta rhythm has also increased. So with eyes open, this is practiced meditation, Rajoga. Change of consciousness from outer self to inner self conscious. And see this, alpha rhythm improving, theta rhythm improving, beta rhythm going down, and delta rhythm also improves on day 7. Rajoga meditation not done with closed eyes. I'm talking to you, but I'm relaxed. I am peaceful and loveful and happy. Right? That is Rajoga meditation. all the time, 24 hours change of consciousness. And this is about sympathetic and parasympathetic activity. See this red line is sympathetic activity, low frequency power. And beta is parasympathetic, relaxation response. Day 7, the sympathetic activity is too much, parasympathetic activity is very less. And day 7 itself, there is a decrease in sympathetic and improvement in parasympathetic. And just after 1 year, there is a total harmony. That means you will face challenges all your life. But with Rajayoga meditation, you will be able to face challenges in life with a relaxed state of mind. You will not have disease, right? Okay. So this is, we have done hormones also, stress hormones, adrenaline, noradrenaline, cortisol levels, 8 AM, 4 PM samples, insulin sensitivity also we have done, endorphin levels, and the serotonin levels we have done, 8 AM and 4 PM samples, very important. After doing a meditation from 4 to 4:30 or 4:45, Amrit Vela, that time you should experience bliss. Bliss means, Anand means bandhan. Anand means mukt, bandhan mukt sthiti. The soul is detached from the body and bodily world and can merge with in God's love, right? Loveleen sthiti, going beyond. If you can achieve that state, there is a harmonious release of hypothalamic factors, pituitary hormones, and the pineal hormone. And in turn, all the hormones, hormonal orchestra of the whole body, the thyroid, parathyroid, pancreas, adrenal, and gonads, there is a harmonious release of all the hormones. And then from the time you get up, your team means mind, thoughts, emotions, attitudes, and memories. With bliss, you trigger positive team. Up to 8 AM, you maintain your positive team, and Murli is 100% positive team. So 7 to 8 we listen to the Murli. So that then their cortisol surge is harmonious, and the whole day you are peaceful, loveful, and happy, and your efficiency increases 3 to 4 times. And if you don't get up in the morning and listen to mobile or television or newspaper, then your team is negative, and so cortisol surge becomes very high, and whole day you are jaldibaji, chinta, gussa, and efficiency goes down much more, right? So that is the secret of this program, right? So अभी आप सुनते हैं हम इनसे ये क्या कहते हैं, सुनिए. और insulin sensitivity also, he will tell you how his insulin was stopped. And because cortisol levels have gone down in just day 7, on day 7, so your insulin sensitivity improves. With lesser insulin, your own insulin, you are able to control your diabetes. And so blood pressure is also controlled, diabetes is also controlled, weight also comes down. You will listen from him. सुनाइए.
ओम शांति. मैं एक आत्मा हूँ. मेरा शरीर का नाम जगदीश भाई पटेल. मैं ऊंझा गुजरात से आता हूँ. आज से 13 साल पहले मेरे को हार्ट अटैक आया था. तो हमने स्टर्लिंग हॉस्पिटल में एंजियोग्राफी कराई. तो एंजियोग्राफी में 5 ब्लॉकेज निकले. एक 100%, एक 95% और 3 70%. डॉक्टर साहब ने सर्जरी के लिए बोला. साथ में EF 25% था. लेकिन मेरे को प्रॉब्लम एक दूसरा और था, वो डायबिटीज का.
इजेक्शन फ्रैक्शन, कॉन्ट्रैक्टिलिटी, यू नो, नॉर्मली 60%, इनका 25% था.
25% EF था. मेरे को डायबिटीज 40 साल से था, और वो डायबिटीज 400 450 रहता था, और मैं करीबन 40-45 यूनिट इंसुलिन लेता था. इसलिए वो सर्जरी के लिए हमने टाइम मांगा, और बाद में करने के लिए डॉक्टर साहब को बोला. फिर यहीं ग्लोबल हॉस्पिटल में सर का प्रोग्राम चलता था, उसका मैसेज मिला, तो हमने केयर प्रोग्राम अटेंड किया. तो डॉक्टर साहब ने जो केयर प्रोग्राम में हमको बताया, खान पान, योगा, मुरली, वो सब हमने 100% फॉलो किया. और 3 महीने के बाद फिर से वो केयर प्रोग्राम हो रहा था. तो हमने.
आपका वजन कितना था? वजन
मेरा वजन 102 kg था.
102 किलो के थे ये, है ना? और ये इंडस्ट्रियलिस्ट हैं ऊंझा में.
मैं मशीनों बनाता हूँ, जीरा सोप साफ करने की. बड़ी बड़ी मशीनें बनती है. हाँ, तो जब दूसरा प्रोग्राम हुआ केयर का, तब मैं आया तो डॉक्टर साहब ने बोला कि भाई जी आप खाना पकाएंगे। जब 3 महीने के बाद
इसकी बात मैं आपको बताता हूँ।
अब मैं 3 महीने
एक मिनट हमारे सामने क्या प्रॉब्लम थी कि हमारे पास लगभग एक ग्रुप में 50 से 60 हार्ट पेशेंट्स आते, एक ग्रुप में ना 50 हार्ट पेशेंट, 50 उनकी वाइफ या हस्बैंड। मतलब वी डू नॉट इन्वाइट एनीवन विदाउट स्पाउस, बिकॉज बीमारी की जड़ तो वहीं होती है ना, है ना। हस्बैंड को बीमारी है तो वाइफ साथ में कारण है, और वाइफ बीमार है तो हस्बैंड उसका कारण है। दोनों को बदलना पड़ेगा, राइट, जिसे दोनों को बुलाते हैं, ये मस्ट है ना। तो हमारे यहाँ क्या होता था, हमारे पास रेगुलर कोई ऐसा खाना बनाने वाला नहीं था जो खाना बनाए, और हम लोग 4 बजे मेडिटेशन करते हैं। तो मैंने बाबा से शेयर किया, अभी आपको शायद समझ नहीं आया मैंने बाबा से कैसे शेयर करते हैं। तो बाबा से शेयर, बाबा क्या करें, बाबा ने मुझे इनका दिखाया कि ये ना, ये एक आत्मा है जो मुझे पता है तो मोटे ताजे हैं, तो ये जो है इसको आप बोलना, और इसकी हार्ट की पंपिंग भी 25%, सांस फूलता था बहुत, इसको चलता नहीं था। तो इसको बोला कि इसको बोलना कि ये खाना बनाए। तो मैंने कहा इसको मैं बोलूँ खाना, इसको सांस नहीं आता है, इसको खाना बनाने के लिए, पर परमात्मा का ऑर्डर है। तो मेरे सामने जैसे आए ना, तो इनका देखा मैंने, इसने आते बहुत खुश थे, उनका वेट कम हो गया था, 85 kg हो गया था, 102 से 85 हो गया था 3 महीने में। और इनके मुझे इको करा के लाए थे, तो कहते मेरा हार्ट का पंपिंग 55% हो गया, 25 था ना 55% हो गया, और इंसुलिन हट गई है, और शुगर अभी खाने के बाद 150 आती है, पहले 450 खाली पेट आती थी, 400 450 खाली पेट शुगर, अब खाने के बाद 150 आ रही है, खाने के पहले 110 आ रही है। इन्होंने मुझे बताया, तो मेरी हिम्मत आ गई। मैंने कहा आपको खाना बनाना आता है? कहता है मेरे को खाना तो कभी बनाया नहीं मैंने, खाना बनाने का टाइम ही नहीं होता मेरे पास। तो मैंने खाना बनाओगे आप? कहते हैं आप डॉक्टर साहब जो कहोगे मैं करूँगा, आप खाना बनाने की बात कहो, कुछ भी कहो मैं करूँगा। तो मैंने कहा आपको सबका खाना बनाना है 150 लोग होते हैं एक ग्रुप में लगभग ना, 125-150 लोग होते हैं। तो कहते हैं मैं बनाऊँगा, अभी तो मेरी जान बच गई ना, तो मैं आप सब कुछ करूँ, जो आप कहो करूँगा। और वो दिन और आज का दिन कितने साल हो गए? 14 साल हो गए,
14 साल हुए।
14 साल
93 प्रोग्राम हमने
93 प्रोग्राम्स
कंटिन्यू किया
ना, एक भी प्रोग्राम को मिस नहीं किया इन्होंने। हर प्रोग्राम में आते हैं, एक दिन पहले आते हैं, सबका खाना बनाते हैं, 3-4 लोगों को अपने साथ लेते हैं, अपने साथी बनाए हैं, उनके साथ मिलकर खाना बनाते हैं। सुबह 3 बजे से काम करना शुरू करते, रात 11 बजे तक काम करते हैं, खाना बनाते हैं भी, खिलाते भी हैं। आपकी बीमारी पहले कैसे रहती थी बताओ?
अभी मैं 8-10-15 किलोमीटर चलना तो चल सकता हूँ। अभी 15 दिन पहले मैं गया था, जो अंबाजी टेम्पल है वही 1970 स्टेप है,
1970 स्टेप
है। तो मेरे साथ 2 लड़के थे, 25 साल और 28 साल का। तो मैं 1.25 घंटे में क्लियर किया। वो बोले चाचा जी थोड़ा धीरे चलो धीरे चलो। मैंने 1.25 घंटे में तो क्लियर कर दिया। और जब से मैंने केयर प्रोग्राम अटेंड किया, पहले तो मैं 1 महीना 2 महीना 3 महीना हॉस्पिटल में रहता था, लेकिन जब से केयर प्रोग्राम मैंने अटेंड किया तब से एक भी बार मैं हॉस्पिटल नहीं गया। इसलिए वो घर वाले ने बोल दिया कि हर प्रोग्राम में आपको क्या केयर प्रोग्राम अटेंड करना है। तो जो 93 प्रोग्राम किए, तो बीच में हमारे फादर ने भी शरीर छोड़ा, मदर ने भी शरीर छोड़ा, कोई शादी आई, लेकिन बाबा ने ऐसा जुगाड़ किया कि वो बीच में ही सब एडजस्टमेंट कर दिया। तो 93 प्रोग्राम हमने कंप्लीट क्लियर किया। जो 102 kg में जो मैं वर्किंग करता था, अभी 52 kg में इससे भी ज़्यादा करता हूँ।
देखिए अभी 52 किलो वजन है का, 102 में सिर्फ 50 किलो कम हुआ है। एनर्जी कितनी है?
एनर्जी 4 गुनी हो गई है।
4 गुना एनर्जी हो गई।
क्या है कि कई बार हमारे केयर प्रोग्राम में क्या है कि पिछली बार प्रोग्राम बढ़ा था, तो अब 270-80 लोग थे पिछले प्रोग्राम में, तो कई बार 30 किलो 40 किलो
प्रोग्राम में 240 लोग 240-50 लोग थे, 250 लोग थे,
तो वेट उठाना पड़ता है। न केयर प्रोग्राम में जो भी पेशेंट आए, मैंने देखा 93 प्रोग्राम से किसी को कैंसर था, किसी को अस्थमा था, किसी को डायबिटीज था, किसी को हार्ट की बीमारी थी, सब जिसने भी फॉलो किया सबको ठीक हो गया। ओम शांति।
हार्ट अटैक मोटापे से नहीं होता है, हार्ट अटैक मन के वेट से होता है, ठीक है। डायबिटीज भी मन के वेट से होती है। मैंने बताया नहीं आपको चेंज ऑफ टाइप ऑफ मेडिटेशन। सी मैंने आपको बताया, चलो मैं भी खड़ा हो जाता हूँ, वैसे टाइम हो गया मेरा। चेंज ऑफ मेडिटेशन क्या है? देखिए मैंने बताया, योग मीन्स कनेक्शन, योग मीन्स कनेक्शन, कनेक्शन विद द ट्रूथ, एंड इट हैज टू बी एटर्नल कनेक्शन। ये नहीं कि आधा घंटा सुबह शाम, नहीं। आप सांस कितनी देर लेते हो? आधा घंटा सुबह शाम लेते हो? आधा घंटा सुबह शाम लेते हो? सारा दिन लेते हो ना? तो मेडिटेशन इज अ कंटिन्यूअस प्रोसेस, आधा घंटा सुबह शाम नहीं। दिस अटेंशन ऑल द टाइम, फ्रॉम आउटर सेल्फ कॉन्शियस टू इनर सेल्फ कॉन्शियस, चलते फिरते उठते बैठते, आई एम अ बीइंग, आई मेक द बॉडी फंक्शन, आई मेक द हार्ट फंक्शन विद एनर्जी ऑफ लव, आई मेक माई लंग फंक्शन विद द एनर्जी ऑफ पीस, I my brain function with the knowledge of truth that I'm a being, not the body. Fear disappears, right? ABCD, Atma, Baba, connection and drama. If this remains in my consciousness, then my brain will function properly, right? My eyes, purity. If I see goodness in everyone, my eyes number will change, right? If I see bad thing in others, my number is going to change on the wrong side, okay? Then purity means your immune system, right? Liver, happiness, super sense of joy means liver and your intestines. The bliss is for hormones and powers are for the joints. Your back why back problem? विस्तार को सार में लाने की शक्ति। हमारी बहनें क्यों कमर खराब जल्दी क्यों होती है? राई का पहाड़ बना लेती हैं, सेंसिटिव नेचर होती है ना, 20-30 साल पुरानी बातें भी खोद के ले आती हैं, है ना। तुम्हारी माँ ने 40 साल पहले मेरे को ये बोला, माँ मर गई है ना, शादी के दूसरे दिन मेरे को ये बोला था, है ना। वो छोटी छोटी बातें भी राई का पहाड़। दैट इज वाई द बैक प्रॉब्लम हैपेंस, राइट। विस्तार को सार में, कछुआ होता है ना, कछुआ, टॉर्टॉइस जैसे बनना है ना। पहाड़ को राई बनाना है, पहाड़ को राई बनाना है, पहाड़ को राई बनाना है। विस्तार को सार, आप जो अपने मन बुद्धि को सारी दुनिया में फैला के रखते हो ना, उसको सार में ला के रखो, ठीक है, ओके। विस्तार, पावर टू विड्रॉ। खाना खाया, चले, बुद्धि को अंदर ले लिया, बस ऊपर जुड़ गए, जुड़े जुड़े ही आपको सारा काम करना है। और समेटने की शक्ति, नी जॉइंट ना, मन बुद्धि को समेट के उस पावर हाउस से जुड़े रहो, तो आपके नी जॉइंट भी बेटर होते जाते हैं। ऐसे कर, मैं टाइम नहीं है इसका, टाइम बहुत हो गया, मेरे को डांट लगाएंगे वो। हाँ, नहीं, 98, Fab 98, 25 years.
This reversal of type 2 diabetes from 2017 and with a very good success, and this month I am going to Germany. We have a ESD program over there. I'll be presenting a case over there, effect of meditation, vegetarian diet and other lifestyle, this thing. Now can you please share me what is your success rate in regression of type 2 diabetes with this method?
See, I'll just tell you, success rate is because we follow them a very, very regular level.
Yes, sir.
And almost, I'll tell you that in our study which we published, the regression, the sort of reversal rate of diabetes was about 90%. 90%. And people nowadays who are coming, it's almost everyone follows sincerely. Each and every patient is followed very, very sincerely in our Brahma Kumari centers. And daily they join me in 4 a.m. in the morning on Zoom, all the patients. And daily in the evening for 1 hour in the evening, 7:30 to 8:30. Right, that is the type of is the type of adherence they do it.
I'll share that data.
And another, Shanti?
Yeah, please.
Right.
I'm sorry to interrupt you.
Time
in
between.
Time
बहुत हो गया,
because we have our next session at 4 o'clock again.
Sorry. You can share with me, so, Dr. Sahab, you can share with me personally. Okay. Om Shanti.
वैसे बहुत सारी queries होंगी और बहुत सारी चीजें हैं.
1 minute of silence. सचिन भाई है क्या? सचिन भाई यहाँ पर? चलो 1 मिनट साइलेंस मैं देता हूँ, मैं नंबर देता हूँ।
हमारे रिस्पेक्टेड गेस्ट भी चेयर पर हैं।
चलिए 1 मिनट साइलेंस में बैठते हैं। मैं मिलता हूँ, मैं यहीं पर हूँ आपके साथ। मैं बता देता हूँ।
सदा खुश रहो, मुस्कुराते रहो, सदा खुश रहो, मुस्कुराते मनाते रहो, गाते रहो, गुनगुनाते रहो, गाते रहो, गुनगुनाते रहो, मिलन प्यारे प्रभु से मनाते रहो, मिलन प्यारे प्रभु से मनाते रहो, सदा खुश रहो।
My number is 7014 हाँ जी 98 हाँ जी।
मैं निवेदन करूंगी आदरणीय डॉक्टर साहब से कि हमारे जो गेस्ट इन चेयर हैं आपका
अनिल भाई आप नंबर बता दो। ये सचिन भाई हमारे सचिन भाई है, ये भी दिल वाले हैं, इनकी भी इनको हार्ट अटैक आया था, इसके बाद हार्ट की पंपिंग बहुत कम हो गई थी, ये had arrhythmias, इनको वेंटिकुलर टेकिकार्डिया होता था बीच बीच में, तो इनको फिर अबाउट 50% वर वीपीसीज, टोटल 1 लाख में से वीपीसीज थे, अभी ही इज ओके विदाउट एनी, ही इज इंजीनियर बाय प्रोफेशन। ये माउंट आबू आगे छोड़ के, फिर गाजियाबाद छोड़ के अभी माउंट आबू रहते हैं। हाँ 7014
हमारे साथ में जो
98 6229 7014 98 6229।
हमारे गेस्ट का फेलिसिटेशन डॉक्टर सतीश गुप्ता जी कर रहे हैं। वैसे तो आपके एक्सपीरियंसेस इतने ज़्यादा हैं कि हम सुनते रहें और लेकिन ज़रूर आपको वापस मौका मिलेगा कभी, आप पुनः जब यहाँ आएंगे तो एक क्रक्स अगर हम देखें तो आपने बताया स्टॉप करें, ऑब्जर्व करें, जो भगवान कहता है उसको रिवाइज और रियलाइज़ करें और फिर स्टीयर करें। SOS का ये मंत्र हम अपने साथ लेकर जाएं टेक अवे के रूप में। और एक बार जोरदार तालियों से हम आपका धन्यवाद करते हैं। थैंक यू।